opening the door wide to new possibilities, hope of real breakthroughs and understanding more big ideas than we could have ever imagined. These are the biggest grants we've ever been able to offer. We're going to come out of this with some breakthrough ideas.
Focused solely on neuroendocrine tumors. You are not alone. We are all with you on this.
I flipped the slide back to the previous one because it's a perfect lead-in to what we hope is going to be a connection made momentarily with Germany. So we're just flipping the speakers on your agenda because of the timing. But I mentioned earlier, you're not alone, as Grace said, because you also have a really incredible, dedicated community of physicians worldwide, as well as here in North America, who are making it their business not only to make their careers, their clinical careers, their research careers, focused on the whole range of neuroendocrine tumors, but they're also committed to coming together. You know, if you're involved in a more common form of cancer, breast cancer, or whatever it is, there are many, many organizations that are focused on those needs. But we're a smaller community both here and around the world, and so it's really critically important that we have the medical professionals come together, and even more important, that we have medical professionals who really want to hear the voice of the patient through the surveys that people like Grace has really helped us produce, but also more importantly, to learn from those surveys what the unmet needs are and work together, not just doctors doing it for or to patients, or patients complaining about their doctors, but really getting together and figuring out where are the unmet needs that you have, where are the unmet needs from the clinical and research perspective, how do we meet and bridge those gaps. And we are embarking now on a process with both the European Neuroendocrine Tumor Society as well as the North American, which you'll hear from in a moment. And with us right at this moment, from Germany. I don't know if you can hear me, Bertram.
Yes, I can hear you very well.
Terrific, terrific. So Bertram Wiedermann is the current treasurer of the European Neuroendocrine Tumor Society. We are so thrilled to have him offer a few words today, not only about ENETS, but also about this amazing collaboration we're just starting between our patient groups through INCA and ENETS. And so without any further ado, and thank you so much for joining us live from Germany, Dr. Bertram Wiedermann.
Well, thank you, Ron. Kind regards from Munich, where we actually just running our advisory board meeting this minute. Also kind regards from your vice chair, Theodora, who's participating as one of the patient representatives at our meeting. And I must say, it's just starting already as a very exciting meeting based on the fact that we discover a number of unmet medical needs that we can break down to the various sites of origin. That is where the tumor develops and then how it spreads. And as we all know, there's not only one neuroendocrine tumor, but there are many, and they behave different, they grow different, they spread different, and they have to be treated also different. And at that point, we just really in the middle of a discussion how we actually identify and prioritize studies that allow us to say these are studies where we will have the support of you as the patients. Can you hear me? Where you, of course, as the patient must have an input. And then, of course, we also have to figure out means how these studies will be doable in a given time, because I think we cannot perform a study for cost reasons in longer periods. Although, of course, you as patients with a disease that is long-lasting, thanks God, we can and have to perform possibly studies in the future where we also look at long-term results. But anyway, what of course comes also in the equation is that we only can decipher studies with regards to better treatment that have the support of the industry or a third party. And we all know that this kind of studies will be very expensive, and therefore one has to be very precise and very restrictive in defining studies that are for the benefit for all of us. And on top of it, make sure that we will have a study in this rather rare tumor entity, including a number of sites and centers of excellence, as we mainly focus on here in Europe, in order to recruit as many patients as possible and thereby also allowing a proper statistical analysis, which of course we cannot do if we have just a small number of patients in a trial to be analyzed. So altogether, I think we as ENETS and the advisory board, which is gathering today with about 60 participants from all over the world, there are also a number of American colleagues participating today. We will probably by tomorrow have the results of this meeting, which in the beginning starts, as we did, just starting at 2 o'clock Central European time, by having an introduction by the chairs regarding the various sites of origin, and they actually ask then the crucial questions, which will be in separate breakout sessions discussed by experts from all the different disciplines. That is, we really have included radiologists, we have included pathologists, surgeons, and all the expert endocrinologists, gastroenterologists, oncologists, in order to ensure that we do a trial that fulfills the criteria and requirements of all disciplines for the sake of our patients. I think this, just in short, hopefully gives you some good idea where we are right now. Maybe I just can say a few words if there's time. I don't know. Ron, if I have time, I just would like to mention a couple of issues concerning the European Neuroendocrine Tumor Society. Our society exists now for more than 20 years, and it encompasses 1,100 members from 40 different countries all over the world. We are, I think, very proud to say that this rather large tumor society was the first to establish a TNM classification. That is, we established, based on a number of studies, a means to define the various stages of tumor development and tumor growth, and thereby we can actually also prognostify our patients and tell them what kind of therapeutics we can offer and what kind of alternatives we have in the long run. We also developed guidelines for the diagnosis and the therapy of these tumors, both in the abdomen or in the belly, as well as now in the lung. We have developed, and this is an issue of prime importance. Last year we had an advisory board meeting where we focused on standards of care. That is, we try to establish standard operating procedures for all colleagues in the radiological departments, in the laboratory departments, so that they use the same kind of methods and measure also the disease in identical terms worldwide. And by doing so, we try to avoid that many hospitals just use, with their little experience, methods that are not up to date. And then I think one of the issues that is in the main focus right now is we've tried to also identify young investigators that have a special interest in the better treatment of our patients. And by that, we have actually grants set up to ensure that we have these young investigators gathered in an annual meeting by a so-called Excellence Academy. And with that, I hope we will be on our way to do more for you as patients, and especially ensure that with all the efforts we can improve the diagnostics and therapy for the sake and benefit for all of us. Thank you.
I hope you heard some of that. We are really excited about the symposium. For the first time this year at the ENETS meeting, there will be a symposium of patient group leaders and leaders from the medical and research community. We're hoping from not just the ENETS, but from around the world, to talk about unmet needs, as they've started the process already today in Berlin, and really see what we can decide are the priorities for really addressing those unmet needs, and work together on both the patient side as well as the clinician and research side. So we're so excited about your leadership in making that possible, and we're really looking forward to seeing you again in Barcelona. So thank you for joining us today, and please give a round of applause to Bertram Wiedemann.